So with the sub-theme National Action Plan for Snakebite Envenoming, let's invite Dr. Ajit Shivale sir, Joint Director NAPSE, Government of India, New Delhi, to give an overview on NAPSE.
Thank you, and it's hard to get a session immediately after the lunch. So again, we'll be starting with the snakebite session, and first of all, I would like to thank Directorate of Health, Tamil Nadu, and NHM department for organizing this very important consultation on snakebite prevention and control. We always look for the states to take their own lead in terms of the health programs. And yeah, so is it okay now? Yeah. So we are thankful that states, especially like Tamil Nadu, are taking the lead in snakebite prevention and control activities in the country. Tamil Nadu is one of the first states to make it snakebite as a notifiable disease, and you have also organized the consultations today, plus the protocols and IEC materials you have already prepared and shared. So we would like that as Tamil Nadu, in terms of like we were discussing about the rodenticides poisoning, you should also lead in terms of the preparation of the state action plan and the implementation. So I will share you about the progress which we are undertaking under snakebite prevention and control program. This is very new program, just launched 2 years back. We had several consultations, and based on that, it is being implemented as a centrally sponsored scheme under NHM, and we will be shortly having a centrally sector scheme also. Next, please. And I would also like to thank our NAPSE stakeholders, National Action Plan stakeholders. Majority of them are from Tamil Nadu. Mr. Ganeshwar, the Dr. Mohan from CMC Vellore, Raghunandan sir. So the stakeholders, and Dr. Shakti is also here. So all these stakeholders are contributing for the activities across India, and if they are already part of the state team, I don't see any reason why Tamil Nadu will not be able to develop a good state action plan. So just to see you, this is just a snapshot of medically important species in the left side and the number of envenoming cases across the different countries. We can see that although India and the nearby countries like the other countries like Australia and New Zealand, they are having similar type of prevalence of medically important species, but we have large number of the envenomings. Majority because the health systems are not much that responsive enough to save the lives. Rather, the transport systems needs to be improved. So many challenges are there in terms of snakebite prevention control. How much cases really burden is in India about snakebite cases and deaths? The reported burden is very less as compared to what is actually occurring in the community. If you see the average snakebite cases as per CBHI is just 3 lakhs, and average snakebite deaths which are reported only 2,000 to 3,000. But the estimates for the deaths in snakebite just recently concluded ICMR study, they are estimating more than 40,000 deaths. The previous estimates were about 58,000 deaths annually. So 58,000 is very huge number, and that is why this issue needs to be taken very seriously. If you see the surveillance system, it has needs. We all need to report all the snakebite cases which are coming to the health facilities. At present, it is being reported under integrated health information platform, and we are getting the line listed data on cases and deaths. And just this month, we are developing a separate dedicated website or data portal under this IHIP for snake bite, where the data of the snake bite victims, we will also align with the data which we will conduct from the snake bite rescuers apps which are developed by different people, and we can align that data about the snakes which are detected by the rescuers and the snake bite victims data, so that the timely actions we can identify the high risk areas. So that thing is under development. We have developed two phases of that particular data portal. So this is just a snapshot of cases reported. Tamil Nadu, if you see, it is just after the West Bengal, Andhra Pradesh and Maharashtra. So Tamil Nadu is one of the leading state in terms of reporting of the snake bites as well as the prevalence of the snake bite cases and deaths. This is just a snapshot of what actually this left side shows cases, right side shows deaths. Just lower down, you can see the Karnataka, Tamil Nadu being the highly forested, the low altitude areas. They obviously have and good reporting system. Mainly, that is the reason I see for reporting of those cases and deaths. What is important just to show this map is that we are just identifying high risk districts, but at state level, you need to find out high risk blocks and villages. That means the blocks which are contributing to more than 50% of the cases or deaths in your particular state. And then target interventions. If you see the cases and deaths district wise, I cannot, Theni is the one of the, I hope I am pronouncing correctly. So that is the which showing highest number of deaths and cases. There are some Tirpuri and I cannot read those names, that above Krishnagiri. So these are the particular districts, but you need to go further down, drop down, and really need to find out if there are high number of cases. If some particular facility is reporting high number of cases but very no deaths, then what is the reason? Is it a reporting issue? If some facility is reporting both high number of cases and both high number of deaths, what is the reason? So there are always different reasons. I hope the epidemiologists are there in this particular group. I don't have that time, otherwise we would have discussed those different scenarios. The major issue which as a country we are facing this, only very few are actually reaching the health facilities. Most of them are seeking the traditional faith healers. So we need to sensitize these traditional faith healers, and for that you need to collaborate with the tribal health department of and the department, Panchayati Raj department. And another issue is about the poor ambulance and pre-hospital care. Very few victims reach timely. We investigated few of the deaths in Karnataka and the Madhya Pradesh. Almost out of 11 out of 15 did not reach in time. So mainly this is the one of the reason for deaths. And there is another reason that few of the victims which are bitten by range restricted species, Malabar pit viper or green pit viper, for which the current antivenom is less effective. So we have also made plan for this particular issue. You must be pleased to know that to address this issue, we have prepared a national action plan for prevention and control of snakebite envenoming in India. The objective is to halve the deaths, to reduce the deaths by half by year 2030. This is as per the global action plan. India is one of the first country to launch this particular action plan. We had extensive consultation in this regard. All these ministries, especially the two ministries, Ministry of Health and Ministry of Environment, Forest, Climate Change. These are the two key ministries. Apart from other ministries, they are involved in this. And we have highlighted the roles and responsibilities of each department. This is available on NCDC website. So I forgot to mention, I am from the Center for One Health NCDC, where we work only for intersectoral coordination between medical, veterinary, forest and other sectors. So this snakebite also needs to be addressed by One Health approach. That means health sector cannot do it alone. We would require the help of Panchayati Raj, tribal health, animal husbandry, and agriculture. So based on this, every state, including the state of Tamil Nadu, has to prepare a state action plan. So these are the snapshot of the meetings. So sorry, this is the budget we provide under the National Health Mission. So we provide budget for one training of medical officers, ASHA, ANMs, meetings for uh, the health, agriculture, and Panchayati Raj institutions. We request that you use digital technology whereby you can map, although we are ourselves developing a snakebite app, you can use that. And drugs ASV should be there till PSC level. I hope the program officers are all aware about these things. These are the activities we have envisaged. What two things I want to mention, that there are two key activities. One is the regional venom center. As I mentioned, current polyvalent antivenom is addressing only big four. So we are preparing a regional, rather strengthening the regional venom centers as a part of central sector scheme. So those venom centers will be located across different regions, and they will pull the venom of that snakes which are prevalent in that particular region, and the manufacturers will prepare the antivenom for those particular species so that it becomes very effective. Second thing is that any snake bite victim should receive almost the 90% of neutralizing dose, and that's why we have made mandatory that a medical officer must give 10 dose vials if he suspects the envenoming. So that is the two key points by which we can save the lives. And also we are envisaging a poison information centers across India. Fortunately for Tamil Nadu, you have the best CMC Vellore Poison Information Center, which I will be visiting tomorrow. And you can take the support of that center to develop similar centers in medical colleges or district hospitals. Next. Sorry. So these are the standard treatment guidelines. This is a protocol which must be there at all health facilities. I have seen your IEC material, which has been excellently developed with the help of your stakeholders. But we have also developed audio, films, videos, and the IEC material. This is freely available on NCDC website. You can go through it and use for the need in your community. At the national level, notification has been done in few states. Obviously, the idea is that all the snakebite cases should get reported. Unless and until we have actual burden, we will not be able to know what is to be done in which areas. So this is what we are going to each state to train the people. Most important thing is we have to investigate each and every death. We have developed a verbal autopsy form, and we can exactly find out what is the reason behind each snakebite death. If we get the reasons, we can understand what is the issue with that particular district, what is the issue with that particular PSC, that area. So what is the reason? Is it a transport issue is there? Whether victims are going to the faith healers, which faith healers, what advice they are giving. So that particular thing can be captured, and then you can direct those things. We have made a checklist of these particular things, emergency drugs, what should be there. So this checklist should be evaluated by program manager at district level and monitored, so that all these investigations, equipments and drugs should be there at PSC, CSC and district hospital level and needs to be monitored. And most neglected part is the morbidity and disability of snakebite cases. So that also has to be addressed by the district hospitals. We have framed guidelines for that. NGOs are very, very key. I think Ganeshwar Madras Crocodile Bank is one of NGOs. There are many NGOs are already working for sensitization. You need to take the help of these NGOs so that where government cannot reach, these are the flexible organizations which can reach and address this issue. So this is what I particularly request to all the stakeholders. Recently in Karnataka, we had this workshop on state action plan. So where we have called almost 28 departments just to highlight, just to frame these roles and responsibilities of different departments for snake bite prevention and control, what actual department that should do in coming 2 to 3 years, so that the role by 2030, reducing the deaths by half can be achieved. So I request that within next few months, please organize this consultation. What needs to be done? First, you need to analyze what is actually your burden, what is the gap, where is the gap. So gaps in terms of whether people are not getting first aid, whether they are not getting ASV, or they are not reaching the health facilities timely. Then secondly, first you have to identify the sectors. What funds are there currently? You have the funds for health sector for under NHM, but whether wildlife department can support the trainings of rescuers, the snake rescuers. So this needs to be seen. And after the identification of the earmarked funds, you need to find out the burden of snakebite cases, actual burden, because this is very, very underreported, grossly underreported. Most of the deaths generally occur in the community. So need to find out the burden, which are the blocks and villages, I am again repeating, which are contributing more than 50% of deaths. These will be the high risk areas which will be targeted for trainings of the medical officers and health workers, and also the NGO participations, so that we can make it as a movement. Only then this issue of reducing the deaths by half can be achieved. So this is how we have framed the indicators. This will be part of your state action plan. This will be actually the interventions which will be undertaken in these high risk areas. Some of the issues which relate with the safe agricultural practices, because we have seen that there are particular practices like in the rainy season, if somebody is filling the gaps with the mud, those farmers are getting bitten. So you have to find out which practice in that particular village is responsible for the biting incidents. So accordingly, those practices needs to be added. Not changing. And if there are issue with the availability of anti-snake venom, I think in the morning it was mentioned that there is no issue about Tamil Nadu availability, so that is a good thing. And once this action plan is prepared, then you can send it to us, we can review it, and then it can be implemented in the states based on the all expert inputs. But what is important is that if you prepare action plan, you need to have a short term, medium term and long term indicators year wise. What I can see for Tamil Nadu is that we can have a strengthen your Venom centers which you have in the as a Urula or any other center. You can expand the network of your poison information centers through CMC Vellore. Most importantly, you have good IT systems, ensure the digitalization of the snakebite cases and deaths. Also, you have map out the hotspot where actually snakes are being rescued, especially the venomous snakes. And few of the states like Odisha, they have established a snakebite treatment centers, and they have formed a dedicated team which have been trained, especially the medicine department, emergency medicine departments, so that you can set up. So we also have a snakebite helpline 15400, where if person calls, he get to know where actually he can go for anti-snake venom treatment, or so that also can be piloted in the Tamil Nadu. So we have highlighted the role of wildlife department at the state level. So this he can use. So this is for the I think the different roles and responsibilities. I will not detail out because this will be covered in the state action plan workshop which you can organize. But the take home message is that at national level, the various states are in terms of various development phases. So in terms of snakebite prevention and control, Tamil Nadu is one of the state which is having one of the highest burden. It is also leading. It has the resources, institutions, expertise, which are already working in this field. But the real need is that you need to have a structured plan, and the structure plan you can take it based on the national action plan. At the national level, we are ready to support from the NCDC side in the whatever instance in terms of provision, the technical support, as well as the facilitation with the other departments of Government of India. So, and first of all, thank you for this is very importantly and timely organizing this workshop. I wish best success of this workshop, and possible constructive points and recommendations should come out of this workshop for snakebite activities, so that they can be at least be implemented by different departments, not only the health departments. So thank you.
Thank you, sir, for that very insightful presentation on NAPSE.